Development, less focus on politics, because that is what people of Kenya are saying.
The County Government of Siaya has confirmed that there is a cholera outbreak in parts of the county that has claimed the life of one patient and affected 6 others. The county is now asking the public using rivers Orombe and Fuluthi to treat or properly boil the water for those sources, as they could be contaminated. Kevin Ogutu with that story.
Last Sunday, the 31st of December, a cholera case was reported in Siaya County. And up to now,
we have had a total of 6 cases. Unfortunately, we lost one patient, an old man of 87 years old from Pala village.
Cholera cases have since been reported in a number of villages in Alego Usonga constituency.
Affected in this current outbreak are Pala village in southeast Alego, Ralak village, Una village, and Usula village in north Alego. A case was also reported in Kominya Kalaka of West Alego.
But while the county boasts of a remarkable pit latrine coverage,
our latrine coverage as a county is actually stands at 95%.
Southeast Alego member of County Assembly Joseph Mboha has something else to say.
Our area is now an open defecation area. We are trying to ensure that each and every home that is coming up has a proper functioning toilet.
According to Dr. Omondi, open defecation remains a challenge at the beaches.
The beaches are unique in a way that they do not function like the other villages. The people who stay there are not permanent. You cannot ask someone to put up his own pit latrine. So for the beaches, we are looking at a unique strategy on how, even as a county government or with the beach management units, we can put up latrines over there.
County government now says it has set up cholera treatment units in selected health facilities in the county. Kevin Ogutu, KTN News.
Let's now link up with our Nyanza regional reporter Kevin Ogutu, who has been following this cholera outbreak in Siaya. Kevin, what more can you tell us, and how serious is the situation on the ground?
A very good morning to you, Zinzi. Indeed, the county government of Siaya has admitted the cholera outbreak, but according to the director of health, Dr. Stephen Omondi, apparently the patient who passed on had come from Nairobi during the festive season. And the information we have is that Nairobi is yet to actually completely take care of the cholera outbreak that was reported there in parts of last year. So far, there have been no new cases of cholera patients or cholera signs being seen, apart from the 6 who've been admitted and 1 who passed on. And the director of health has already is already, according to his statement, the county government is already in partnership with the beach management unit to ensure that they also install pit latrines in those parts of the county where apparently the pit latrines have been lacking, and which is actually a major source of the spread of cholera. So far, we have not had new incidences of cholera. That's the information that we have. And the county government has said that they are already having plans to ensure that they mitigate these so that there are no more spread. Back to Zinzi.
Kevin, what more can you tell us about the sources?
Sorry?
What more can you tell us about the sources of the cholera outbreak?
Oh, okay. The admission came from none other than the director of health, Siaya County Government, who is Dr. Stephen Omondi. And indeed, in his admission, he said the incidences have been reported with 1 fatal case being witnessed. So that is the might that we have regarding the source. So this is just actually parts of Siaya County, to be more specific, Alego Usonga constituency, or sub-county for that matter. And we have a number of villages that have been affected. We have Pala village, where actually the deceased came from. We have Relak village, Una village, Usula village in North Alego, and Kamunya Kalake village. So these are a number of villages in Alego Usonga constituency, or Alego Usonga sub-county for that matter. And the area member of County Assembly has actually urged the public to ensure that every other upcoming home installs a pit latrine first and ensures that they also use clean water whenever they visit the pit latrines. Back to you, Zinzi.
Kevin, some of the schools within that area have been built that are close to the river. What more can you tell us in regards to the education, or rather the schools that have been built around there?
Okay, the information that we have is that this has not really affected the school-going children. The effect has not been felt in schools per se. And what the county has said is doing is it has installed a cholera treatment unit. And according to Dr. Stephen Omondi, they are doing this in partnership with community health volunteers in the county. So this is one of the measures that's supposed to ensure that this menace, which according to them, they've actually managed to nip it in the bud, will be actually dealt with in good time. Because as I mentioned, the county has not reported any additional fatalities or admissions other than the initial figures of 6 admitted and 1 fatality that was reported. Zinzi.
All right. Kevin Oguto, our Nyanza regional reporter, bringing us to speed on the issue